Welcome back, everyone. We have invited Katie Walker, and she's the Clinical Director of Mental Health and Recovery Services Board. Welcome, Katie. Housing for people with those struggling with maybe mental issues, substance use abuse disorders, it's hard to find housing sometimes, so we're going to talk about that.
Yeah, it really is. It definitely can, their ability to be resilient and resourceful can sometimes be limited, and so sometimes getting that housing can be a challenge.
Yeah.
So with the judgment and the stigma too.
Right, and talking about stigma, it's like, of course, there would be a lot of stigma out there. There's stigma for everything, really, but specifically on these cases, how is that going about with housing? There's a lot of homeless. We were just talking about that. Yeah. We don't want anyone to be homeless, of course, but we want everyone to have a place to live. So how does that come about where people might say, hey, this, it's okay, let's give it a go?
Yeah, well, certainly housing is imperative to treating those disorders as well. So it's very important for individuals to have that opportunity. Mm-hmm. Some of those barriers that they might have are just having limited income, having, some legal challenges, different things that could be a barrier to that. But we've identified a program through Ohio Department of Mental Health and Addiction Services for a grant, a landlord incentive grant, to help to address some of those things.
Okay, so tell us about that. Can you talk to us about that?
Yeah, so the board had an opportunity to apply for the grant for the landlord incentive funds. We are partnering with WOCAP to be able to deliver that to the community. It's for new private landlords that are willing to abide by the HUD standards for housing and willing to rent to this specialized population. And it can provide them up to $2,000 per individual to be able to assist with a variety of different things, small repairs, security deposits, a variety of different items.
Right. Now, let's say I was a landlord, and I thought, well, this might be something I might be interested in. How do they go about doing that then? Participating?
Yep, so they would contact WOCAP. I believe they're going to join you next week and talk about some of the logistics of that, but they've got an application process to being able to determine who's eligible and get those funds out there.
Okay, and then what if I was a person that, was suffering from, let's say some sort of mental disorder or one of those stereotypes or whatever, that might want to look for housing and they haven't found it yet, they're having some issues. Is there steps that could go about getting housing?
Sure. So a lot of times through their treatment providers, if they have a case manager, if they are using some of those supportive services, sometimes they can help them, or even whatever services they are receiving there, usually has some tips on how to obtain that.
Okay.
That type of housing.
Okay, very nice. Is there anything else that maybe you can let our audience know while you're here?
That's really what I've got for now, but we just know that it's important for people to be able to have that stability, and so it's just something important and near and dear to us.
I was going to say, stability is probably the main point to recovery, I would say.
Absolutely.
You need that stable environment, and then from there you can grow.
Yep.
Right? Am I right?
You're right.
All right.
Absolutely.
Well, Katie, thank you so much for coming on today. I really do appreciate it.
Thank you.
All right. Well, don't go away because medical news is coming up next.